Good afternoon, ladies and gentlemen. My name is Brittany Boggs, and I'm here to present an oral presentation regarding adolescent perceptions of electronic cigarettes. Electronic cigarette smoking and vaping is a national health care problem in the adolescent population across the United States. Despite their appealing colors and fruity flavors, these devices contain unhealthy substances such as nicotine and are deemed harmful. Nicotine can harm parts of the developing adolescent brain that controls attention, learning, mood, and impulse control. Proposed intervention and supporting evidence. In the adolescent age population, how does implementing educational techniques compared to no education affect the perception of electronic cigarettes or vapes within 6 months? Previous research, Level 1 systematic review. Study findings by Vygotsky revealed that each of 4 intervention groups had a significant impact on adolescents' perception of nicotine products. The school-based interventions significantly increased knowledge of smoking, consequences of smoking, reduced positive attitudes towards smoking, and reduced the risk of adolescents starting to smoke or lifetime smoking. Participants in the nicotine prevention campaigns had more knowledge of health risk associated with nicotine use and more knowledge regarding chemical uptake from smoking than the control group and expressed more negative attitudes towards smoking than the control group. Over 60% of the adolescents saw warning labels on cigarettes packages, discussed negative consequences of smoking, and discussed quitting smoking. Advertisements also promoting electronic cigarettes influence the adolescent's perception toward usage of the devices, even if done subliminally. Another research study, a Level 2 randomized control trial, study findings by Lazard revealed that participants who were in the study group, regardless of message format type, obtained a statistically significant amount of knowledge and belief of harm related to electronic cigarettes. The results of the dependent variable after intervention of messages viewed in the study group are as follows. The main effect of message topics perceived for message effectiveness, cognitive elaboration and effect. Adolescents who viewed social media messages had greater knowledge about electronic cigarettes than those who did not see any messages. Regardless of the message format, viewing electronic cigarette messages also had an impact on beliefs. Adolescents in all social media message conditions reported significantly greater beliefs in harm from electronic cigarettes, such as damage may occur to my body, compared to those in no message control, with no differences among the formats. In a Level 4 qualitative review, Popova conducted qualitative study to assess the adolescents' and parents' perceptions of electronic cigarette prevention messages. This resulted in mostly positive results from both the adolescents and the parents. Participants' reactions to harmful ads and chemicals were positive when adolescents recognized the chemical name, acetone for instance. Adolescents expressed that acetone was a strong chemical and it scared them to hear that it was an ingredient that they were putting in their bodies. Many participants were willing to offer suggestions for improvement messages and requested messages that focused on adolescents who were already addicted to these electronic cigarettes. A theoretical framework that backs up this project is the public health nursing model. It was developed during a time when healthcare environments began emphasizing the protection and promotion of health, access to health services, prevention of illness. Public health nurses should remain the forefront in changing the focus to primary prevention. The public health nursing model addresses concerns to specific target populations while focusing on a primary prevention. The plan. The plan is to create a research team. In this instance, a pediatrician, family nurse practitioner, behavioral health specialist, licensed child therapist, elementary school teacher, middle school counselor, high school principal, The team will be led by the family nurse practitioner and workload dispersed evenly to all team members. The research team will meet on Tuesdays and Thursday afternoons in the month of July to evaluate the problem and gather the research. High-risk adolescents aged 12 to 17 years from middle school and high school will be recruited to participate in various electronic cigarette educational delivery methods after they're pre-screened by the Kraft 2.1 plus nicotine during the month of August. A population of 400 students consisting of 215 males, 185 females, 175 middle school students, 225 high school students. The students are from Caucasian, African, American, and Latino backgrounds. Parental consent will be obtained. Educational techniques will be dispersed randomly every week via social media platforms, educational pamphlets, and posters during the month of September. Adolescents will be quizzed the end of September immediately after exposed to these educational techniques. The Kraft 2.1 plus nicotine will then be repeated in 6 months to evaluate educational methods. The research team will meet weekly in March to evaluate research and determine if the educational techniques impacted the adolescent's perception in the post-Kraft 2.1 plus nicotine. Measuring the outcomes using the Kraft 2.1 plus nicotine. It's the most well-studied adolescent substance use screener plus nicotine available and has been shown to be valid for adolescents from diverse socio-economic and racial ethnic backgrounds, acceptable for adolescents 12 and older. It asks multiple choice questions about alcohol, drug usage, and has a specific section with questions regarding vaping and nicotine usage. The tool can be self-administered or administered by a healthcare provider. Adolescents require privacy when answering questions, and confidentiality should always be maintained. The Kraft 2.1 plus nicotine can be utilized in an outpatient rural health clinic setting. Can be used as a tool to screen adolescents at risk for electronic cigarette usage and as a tool to screen post-education techniques to determine if education had a positive impact. The time frame of this project will be from July to April. Research team will meet in the month of July, recruit the participants in August, educate in September with a follow-up Kraft 2.1 plus nicotine screening on September 30th, follow up with the Kraft screening in February, evaluate the research findings in March, and disseminate research in April, meaning the project will last approximately 10 months total. Our children are our future, so let's make their health our priority today and educate them to prevent the usage of electronic cigarettes. Thank you.